Hi, I'm Dr. Lynn. I'm going to show you some self-massage techniques for the pelvic floor. There are going to be some techniques that are more compressive. You're going to be putting point pressure with your fingertips and gently massaging an area that might feel firm or tender, sort of like a muscle knot. And there's going to be some other techniques that are more of a gentle fascial gliding or fascial release technique. I'm going to be showing you over clothes, but at home this would be best to do with your hands directly on skin. First, let me point out where we'll be working on this pelvic model. So the first technique I'm going to show you, your fingers are going to be like an upside down V, and you're going to put them over the labia and gently drag the skin and labia upwards, like that. Okay. Then you're going to put an index finger on either side of the labia and gently drag the skin and fascia in opposite directions by moving one finger down towards the floor and one finger up towards the ceiling. Then you're going to lay on your side, and I'm going to show you how to use your fingertips to hook under your sit bone and buttocks and do some small fingertip circular massages along the pelvic floor, and gently pull across the perineum area to glide any fascia and skin layers that might be a little sticky, a little tight, that might be adhered or stuck to that perineum area and the center of the whole pelvic floor. So start laying on your back. I'm going to angle myself a little bit so that you can see well, but you would just be in a comfortable semi-reclined position in bed. Make your fingers into a V and lay your fingers over each labia. Compress inward so that you feel like your finger skin sort of gently sinks into the labia, and then maintaining that contact, you're going to pull upwards towards the ceiling in your pubic bone. You can follow the curve of the front of your pelvis a little bit. And you want to feel like you're dragging the skin. So if I did it on my arm, I'm not just, it's not like a petting a cat motion. I'm actually sticking my fingers to the skin and then dragging it, almost like I'm trying to wiggle the skin versus just slip right over it. Okay, I'm going to show you that a little closer. So this would be like petting a cat. My fingers are just sweeping the skin. For this technique, I'm really gently pressing into the skin and then maintaining that contact and pulling. So you get this skin wiggle effect. I'll show you on the back of my hand. You're sort of wiggling the skin versus just brushing over it. When you pull, you're going to hold for about 10 seconds. Take at least one long, deep breath, just trying to gently balloon your pelvic floor and belly outwards during this technique. You can take a second breath. And then gradually release. Okay, and you repeat that about 10 times. Or talk with your therapist about customizing your program. Okay, now take each of your pointer fingers, lay one on each side of the labia, and now you're going to glide one finger down and the other up. So I'm exaggerating here, but one of my fingers is going down and the other's pulling up. I'm going to hold for about 10 seconds, and then I'm going to reverse. Okay. Similar to the last technique, I'm maintaining a little bit of inward compression so that I'm gently dragging the skin, not just slipping over it. Okay, so One finger is traveling down, other finger is traveling up. Taking a really slow, deep breath, and then I'm going to reverse it. So I'm releasing the tension, coming back to center. And now my right hand's traveling down or dragging downwards, and my left fingers are dragging upwards. So you could repeat this on each side about 10 times. Now you're going to lay on your side and try small fingertip circles right over the pelvic floor. So you're going to reach around your buttocks. Your fingers should be sort of a hook shape. You're going to find the base of your sit bone, like a little bony landmark. And then if you come to the center line from there, that's about where your perineum is, you're going to press inwards on the top side. So it's a little hard to cross midline. So you're just going to stay on that top side. So for me right now, it's my right. Sink your fingers inwards. In this case, inwards is towards the top of your head. Maintain moderate pressure and perform small circles. You can do 10 in one direction and then reverse and do 10 in the other direction. Okay. And then you're going to move your hand a little closer to the anus. So again, you're going to hook over the buttocks, hook your fingers right next to midline on the top side, and then maintain inward pressure and do small fingertip circles again. Just so that your wrist doesn't hurt, you can move your whole arm from your shoulder instead of trying to do little wrist deviations where your wrist and fingers could get more sore. You could follow up this technique by gently pulling the butt cheeks apart and holding for about 10 seconds. You can try this along a few different points, spending more time if you feel like there's a tight line of pull or tension as you gently pull the buttocks away from or off of the pelvic floor. This helps release tight fascia between the hip and pelvic floor structures. Remember to keep doing deep, long, slow breathing throughout these techniques. It's better to do less circles and less pulls, but go slow and gentle and take your time versus rush through a lot of repetitions. Okay. And then you could turn over to your other side and repeat so that both sides get treated, or you and your therapist will likely discuss if you might want to spend more time on a certain area depending on your symptoms. Try these techniques and let your therapist know if you have any questions about customizing them so that they're just right for you.